I ended up having this arterial bleed from a mucosal defect right there at the anal verge, and of course it wasn't prepped, so there was a
Mhm.
ton of stool coming. And I couldn't see what I was doing, and I had to get the clips on there perfectly. It was like a little bit, there's some distance from hemorrhoids, and you really had to just nail this thing right away. And then I remembered that we had ordered the air assist at this specific hospital because I was doing locums
Mhm.
there. And I said, like, pass me an air assist. And I put it on, and it opened like a beautiful flower and gave me the opportunity to see exactly what I was doing, put the clips exactly where I
Mhm.
needed to be. And we saved this guy surgery and a trip to we didn't have IR capability, unfortunately, on that specific day. And so
Oh,
really was instrumental. It sounds like a little sales thing, a little sales pitch, but
yeah.
but in those instances where you just need to see what you're doing, it's fantastic. You're gonna find that when you really need it, you're gonna love it. And when you want to use it just to get through the colon, make sure that you're seeing everything properly, even if you're using endocuff and you want to be able to, or GI Genius and you want to see behind those folds and just distend a little more, it's great just to have on the scope. And it's easy to use. And I'll kind of tell you how I go through with it. So when you need the air assist, it's fantastic and it's instrumental. And when you start your procedure, you'll kind of
Mhm.
anticipate, especially these older people that have diabetes, COPD, maybe hemorrhoidal surgery, multiple childbirths, the typical
Mhm.
where you would expect less of an anal sphincter tone. And then when you finally express their anus by lifting
Mhm.
the buttocks, um, you'll see that you'll probably have some air escape. And then, if it's somebody that you know that you're going to be doing a large left-sided lesion or somebody with a lot of diverticulosis,
Mhm.
um, and somebody that you would has a lot of history where it's like their third colonoscopy and then you always find, 6 to 10
Mhm.
polyps. It's always good to just slide it on because it's just so easy to use and it's so great to have it ready. Um, Sometimes you'll go all the way, you perform your colonoscopy and on your way out, you'll be in the left colon and you'll start to experience air escape on the way out. And then you can just take the scope out and just put it on. It's easy enough to do. I mean, how long does it really take to get to the cecum in most cases? 3 minutes, 4 or 5 minutes
Yeah.
maybe.
No.
And then if it's just the left colon, you just pull it out and then you can apply the air assist and then just go back to where you are. What I've been doing is sometimes if there is an active area of interest, I will literally just take like a forceps and just kind of clamp down on it just to make a little red mark or a
Mhm.
suction polyp, and I'll know exactly where to go. I'll look at the number on the scope, and I'll know like at
Mhm.
45, that's probably where the area was that I initially was, and then I can just advance the scope right back to that area. So, you have those typical patients, you kind of anticipate that there's going to be air escape. Sometimes you'll put the scope in and you'll hear the air escape immediately. Um, just take the device. What I do is I just squeeze gel. This is the first
Mhm.
iteration. I redesigned this and made it flatter so you have more perianal contact. It's more of like a flying
Okay.
saucer, less than like an arrow. You have less of an angle here, and the internal gaskets are much wider. So I used the pediatric colonoscope yesterday and it just fits on the pediatric colonoscope. I had no air escape around the instrument. I had no air escape between the anus and the device. I had no air escape
Mhm.
through the colonoscope and the gaskets. So it works great with pediatric, and now the adult, it slides effortlessly. So it'll be
Mhm.
fun to use. It won't be cumbersome. I think the size, we nailed it. It's large enough to be able to grab
Mhm.
and manipulate. So you'll just squeeze a little gel right in. This is the back part. So you just squeeze a little gel in
Mhm.
there. You slide it onto the colonoscope. Either, some people like to use it when you go in, that's fine. It actually, you can slide the scope through this, and this will just press up against the anus, and you can just slide the scope in as you need to. I generally just slide it right back up to the hub. And when I need it on the way out, I'll slide it down. And as you come out, if you find that you're just having a very floppy colon and you want to, you're having more air escape than usual, you
hmm
just cinch it with your thumb as you come out. You just kind of squeeze it, and it just stays right up against the anus like that, and you just come out like you usually do. If you find a polyp, you could either, I use this thing so often that sometimes I just leave it there, and if I get proper air distension, if I need the air distension, um,
hmm
I'll just leave it there, and you generally have a few seconds, before it collapses again. I'll just start the advancing my snare, um, and just leave this in place. And you could even use the scope and push it, and it'll maintain some degree of air um,
hmm
retention. And then once you get your snare in, you could literally just, how you make those fine tuning adjustments to get the snare exactly where you need it. You can actually push this in and keep rotating it around the anus, and it'll maintain air
hmm
distension. I have a good video on our website. You could see it being used in real time. We don't show that I actually have the device on the scope,
hmm
but you can see how it's in a segment that's just completely collapsing. I slide it down, and then you can see this little polyp that becomes apparent. And then you can see how I just snare it quickly. And then it's where I would have been fiddling probably for about 10 or 15 minutes. And um, so you can see it in action. The other thing is with now we're using more cold snaring. It's really important that you know your margins, and that because if you don't get around enough tissue, it's like, what's the point of doing a cold snare? I trained when we were using hot snares, so it's like you can get around 99.99%, and with the burn, it'll take care of whatever excess tissue that you don't get. And now it's so important to get around the tissue, that this is so great because it really distends, and you can see exactly what you're doing. Large
Right.
pedunculated polyps in the left colon with diverticulosis, it makes it feel safer. Sometimes when you have these big floppy pedunculated polyps, you don't know whether you're doubling up on the stalk. You don't know if you've got the end properly. And this will just give you that confidence that you need to really see exactly what you're doing. And then if you decide that maybe it's a little technically challenging and you need to maybe make a little more adjustments with whatever accessory that you're using, have your tech just hold this in place. I had my tech yesterday with because you want to make sure that you don't squeeze it too much, because it may get frustrating with the movement of the scope within the device. So it doesn't
hmm
require any axial pressure. You just hold it lightly, or you can put most of the pressure up by the diaphragm, or you could just hold it down here with a finger, and that's all you need. And then if they're holding it right here at our grab, there's like a mid-cylinder grab here. And I added that so in case you slip around, you could literally just hold it easily without squeezing. So my
Right.
experience with buttock pressure is that first of all, it doesn't work. Secondly, it impedes the movement of the colonoscope, because when you're
Right.
pressing on it, especially in the case I had yesterday, because it was so close to the anus, um, it would have really had been, it would have squoze the distal aspect of the scope, and I wouldn't have been able to get that fine movement where I need to get it in perfect position so I can get the clips on properly. Radiation proctitis, if you have a case of radiation proctitis and you know that you're going to get like a little bit of air escape, and you don't want to burn right there at the dentate line, and you really need to see what you're doing, slide one of these things on. It's easy enough to do, it's cheap enough, and then you know that you'll have the visualization that the case will require. If you do colonic stenting, where you have a left colon mass, and you really need to see where to put that wire, you have a fine lumen. So it's really just squeezing the gel when you
Yep.
sliding it on the scope, and either leaving it there when you push in, having your tech hold it whenever you want. You can pass it off like a baton. At the very least, it takes place of buttock pressure.
So I actually tried it on. I was on call this past weekend.
Okay.
Uh, it seems to work. Yeah, relatively well. I did like it. I guess some of the tips you gave me about how to hold it are going to be helpful, and I'm going to try them the next time I use it. I guess one of the challenges that I had it was, as you're withdrawing, that the device comes with you too. But
Yeah.
I think your trick with the thumb is going to be helpful, and then I'll definitely try that next time. I had a case of a bleed, like the one you described, and yeah, it was really helpful to visualize. Um, so yeah, I think it isn't a good device, and we'll keep on trying it over here.
There's always a little bit of a learning curve. And you'll find
Yeah,
that when you
yeah,
hold it
absolutely.
closer to the end, it's going to be the control that you have is going to be pretty fun and to be able to just slide it down with your thumb. So yeah,
Right,
just
right.
just use it more, and you'll find that it'll become second nature. Remember to lube it up well inside, just in case you use a lot of adult
Internally.
colonoscopes.
Okay.
And whenever you feel like it's not sliding enough, just squeeze it down, and then you'll get more gel contact on the scope. You just do that,
Got it. Okay.
and you'll
Okay.
find
I think
little
that's one thing I
tricks.
didn't do.
Yeah, yeah, you'll put enough gel in there so but it should slide effortlessly once you have enough gel in there.
Mhm. Okay. Perfect. I think that's something I didn't do because it felt like it had like a little silicone in there. It had like a pre-lubricant. Is that correct?
Well, yeah, it actually it's a little bit buttery right now, but it's not true self-lubricating silicone like we were using. But it does
Okay.
have plenty of slide. If you just get some gel in there, it's going to be all you need.